Our health and wellness correspondent Rachel Fox is at Next Day Orthopedics at St. Mary's Hospital speaking with Dr. Barry Snyder about a new program there that's changing lives. Hi, Rachel.
Thanks, Kelly. I'm here with Dr. Barry Snyder at St. Mary's Medical Center, and we're going to talk about the Next Day Orthopedic program. Hi, Barry. How are you?
Good. How are you, Rachel?
Good. I'd love to hear about the Next Day Orthopedic program that you guys have here at Medical Center.
St. Mary Medical Center is, of course, expanding by leaps and bounds. And as a result of it, one of the programs that's being initiated is same-day care. Before this was initiated, and it's been in the last year or so that we've seen it, it just wasn't available. There were quality facilities. I like to think that St. Mary's is probably the bar that all are trying to reach. But there was a wait, and orthopedic surgeons were busy people, and it wasn't always there for patients who then had to fish around from one phone to another until they found somebody and found someone who had their insurance and all of that sort of stuff. Well, St. Mary decided at this point, St. Mary Medical Center, that is, decided at this point that it will act as a central hub for patients who have need, particularly urgent need for care, and in calling that one specific number and then led into their navigating system, they're put in touch with people, and then they can obtain it. There's a phone number that you call at St. Mary, 215-710-5888, and you're asked to prompted rather to press 4, and it puts you right in touch.
If I were wanting to become a patient for this program, how would I know that this is something I would need? What are the extent of injuries that you're able to treat?
Well, it really follows a whole spectrum of problems, and it's probably fair to say that under most circumstances it's probably better, if you've got a doubt in your mind, not to judge whether or not it would be appropriate. I'm not promoting that people should call for every little ache and pain, but if there's something that's out of the ordinary, something that seems to be bothering you that you know of yourself is not right, and you're looking for someone then to evaluate it and to manage it, of course there's your primary care physician always, but there are those things that are specific to the skeleton and to the muscles and tendons that move it and the ligaments that hold it, and particularly if you've had some recent injury, something that is just amiss. At that point then, it's probably a reasonable thing to call the hospital and take it from that point forward.
Definitely. So how many other doctors, including yourself, are on this staff to assist the public?
Wow, well, St. Mary's is, I think I'm losing count. It's about 45 or 46 at the last count that I can recall, some of whom are within large groups. I'm in a private single practice and have been here in Bucks County for about 34, almost 35 years, and there are several other people as well as myself who are in private single practices. That might actually be something somebody's looking for, if you like that personal touch, but at the same time, there are those large groups that offer multiple disciplines. There are some groups that offer total joint replacement, and there are some groups that offer sports medicine. Within the very same group, fracture care and other acute injuries. What we're really dealing with here is not some of the first things I mentioned, but for the sprained ankle, for the weekend athlete that was just hurt, for the hot swollen knee that's really giving them a problem and it seemed to have been just fine days ago. Those are the acute injuries that are addressed by same-day care. You call St. Mary's, you call at 710-5888, and you are put in touch with the proper people and directed to those who can judge whether or not it's something you need to be more concerned with. And of course, from there, St. Mary's has all of the facilities that can then deal with that diagnostically. The imaging services are just prime in this area. it easily is comparable to anything within the whole Delaware Valley region.
Yeah, that sounds wonderful. St. Mary's has always been the next up and coming thing, so this is great that they have this program. What other direct benefits do patients have through going through this program?
Well, let me take you back a moment.
Okay.
I said I've been in the area here in Bucks County after I finished over at Penn, and I left the Philadelphia area. I'm from Philly,
Okay.
and I came to Bucks County. I've been here for now, as I said, close to 35 years. I'm on staff at 2 hospitals, but frankly, I don't do any of my surgical care or send my patients, for the most part, for care to anywhere but St. Mary Medical Center. I just have a tremendous level of trust in the quality of care that I see. And I'm in touch with a lot of the resources that are out there within the Delaware Valley region and New Jersey, and I don't find any of them that excel beyond St. Mary Medical Center. I think that the resources here are tremendous. It really has become a brand. People know St. Mary Medical Center. It's hard not to hear about St. Mary Medical Center. It's on television, it's on the radio. We're doing this, and people know it. It is something that comes to mind, like when you talk about facial tissues, you have certain brand names that come to your mind.
Right.
St. Mary Medical Center is just that.
I would agree. I've been in Bucks County my whole life, and I know St. Mary's to be a wonderful place, so that's great, and especially with all the advertising. So how is this program being advertised to the public?
We've discussed this, and we actually have physicians. And let me say, that's one important point. St. Mary Medical Center hasn't done this on their own.
Okay.
Every step of the way, it has been with the counsel and guidance of the physician staff as to what is germane to St. Mary Medical Center, because we're the ones that are taking care of the patients,
Right.
Not some administrator that's sitting back in an office. So the hospital has been very, very much in touch. And so there has been all of this exposure that you've seen accelerate over the last year or so. So the advertising is the initial part of it. But it is advertising that within a very short period of time has to convey forward to the public what it is that we do, what our capabilities are. Most all of the physicians here are university trained and all board certified by their respective boards, some board certified in their subspecialties, hand surgeon, sports medicine, trauma. These are all available so that you have subspecialists, and particular in the last couple of years, trauma, that is major injuries, highway injuries, people that are just mutilated in accidents are adequately treated at St. Mary Medical Center here. Those resources are available. So the advertising has made that known. But the advertising is never enough, because the litmus test is whether or not the people who then, by prompting from the advertising, seek medical care, if they then bring back the very same sentiment. Take a look at health grades. St. Mary Medical Center on the internet has an astounding record on health grades. We have received in this hospital commendations by numerous groups. I won't mention any one of them specifically, but I'm sure that those are available if you call the hospital. And we have letters, repeatedly letters that come back from patients that have been treated here that over and over tell you, this is the place I'm going to go. I love St. Mary Medical Center. I have patients who tell me that all the time. I'm happy you're on staff at St. Mary's. That's where we always go. So the litmus test is through that whole chain of events. And there's one last thing. All you have to do is just follow down Route 413, and just take a look at the physical plant that's being built here. That physical plant would never have come to be were it not for the confidence that the community has told the hospital they have.
Well, there seems to be a great source of doctors and resources, so how do I make an appointment?
215-710-5888. And from there, you'll be prompted to the navigator, press 4 on your dial pad. It's on autopilot from there. You'll get to a navigator, as we call it. You'll discuss the problem briefly, and from there, you'll be put in touch with the proper resources.
So Barry, tell me, when people make these appointments, who are they seeing for care?
They're going to see the doctor that takes care of them. I mean, there are physicians that are assisted in their office, and it's an integral part of care to have physician assistants and nurse practitioners. But people want to know that the doctor that's going to take care of them, and just because we're surgeons, by the way, the majority of people are never operated. We can manage these things very often, quite often, without having to take you to an operating room and bring out a scalpel. But whatever the mode of treatment may be, whether you're going to be referred in here to physical therapy or it does take the other end where there's surgical treatment, you're going to know that the physician that you're speaking to is the same physician and the same group of physicians that will be responsible for your care. You know where the buck stops, so to speak.
I think that's a great aspect of this new Next Day Orthopedic program.
Sure.
So thank you so much for sitting down with us, Barry.
It's my pleasure. Thank you.